We've heard from some healthcare systems that they're being inundated with requests for people who want to be tested so they can go celebrate at the holidays. They don't have an exposure, they have no symptoms, but they want to get tested to be checked so that they're safe to go. I think the important thing to remember about testing in that capacity is testing tells you whether or not virus is detected on that day. There has to be enough virus to be detected, the test has to be performed properly and processed properly. All those things are aligned. All that tells you is I don't have a detectable level of virus today. Doesn't mean that in a day or two, if you were exposed, a week ago, that you don't develop symptoms and become infectious. So I think it's really important for people to understand what the test tells us and how it tells us things. Who do we want to get tested? We certainly want people with symptoms to be tested. We want people who have had contacts with people who have COVID to be tested. In an ideal world, if we have testing readily available at every corner, we would want everyone to get tested. That would give us more information. So I think part of it is local. What is the capacity of the community to test, both in drive-through settings or in providers' offices? So I think that yes, we want people to get tested with symptoms and close contacts. We want people who are in congregate settings to be tested, especially those who are working in skilled nursing facilities or facilities where other folks who might have underlying health conditions or vulnerabilities live. But we also don't want to strain what is a finite capacity, just to testing to reassure ourselves that we're okay. It's not going to tell us we're okay in a week. It might tell us we're okay for a day or two. So we're asking a lot of people. We're asking people to forgo their holiday plans, to stay away from their friends and family, and really right now to reserve the test for people who have symptoms and who are close contacts, and or if you're concerned you're a contact, but not to get it's okay to go out and about safety check.